We define advanced Parkinson's when people start to have difficulty with controlling their symptoms over periods of time. What are the symptoms then? Things like having a tremor is one. That's a very obvious one. But there's other things as well, like an increase in muscle tone, a certain stiffness. People also have non-motor symptoms, things like feeling down, not feeling sharp, not being able to communicate well. Mr. Clayton is a man who had DBS surgery, deep brain stimulation surgery for Parkinson's disease.
My DBS helped my tremor some, but since I had this here, DUOPA, I've had my DBS turned off during the day and only used it at night.
The golden standard in the treatment of Parkinson's is a pharmacological agent called levodopa. Levodopa gets taken into the body and taken into the gastrointestinal system, gets absorbed in the blood, and is offered to the brain. Then the cells in the brain take this levodopa and produce and store a neurotransmitter. It's a chemical messenger called dopamine. As time goes on, there are additional changes in the brain so that we have less dopamine in the brain and less cells that make and store dopamine. Mr. Clayton developed over time a need for more levodopa.
Explain to people what I was trying to tell them about the ups and downs I have. I come a little analogy. I was like going to an amusement park. We were ride that roller coaster. Pretty exciting. You climb up, and then you tip over, and then there's a thrill going down. But when you get down, you get to the bottom, and you crash. I'd crash, and then I'd go back up, back down and crash.
He would come up and would be on and could perform and participate in life. And then he would be taken down at the speed of a roller coaster into a deep off, which is a wearing off of the drug, sort of like our battery running down, as it were. But if we have too much drug in the body at any given time, people have movements of the body that are uncontrolled.
Before DUOPA, I was taking medicine every hour, because I had about 20 minutes of the hour that I could be up and doing things. So quality of life and going somewhere was impossible.
We offered this therapy to him, and he uses the DUOPA. This allows him to walk around. He walks in the woods. He's busy with his hobbies again. He's able to do his photography, which is actually very fine work, using the camera and making the adjustments.
I don't crash no more. I don't ride that excited roller coaster. I'm on the monorail. Monorail doesn't go very fast, not very thrilling, but I get to go. That's how DUOPA's helped me to level up my playing field, and now I can go somewhere and not worry about it.
Giving the dopamine back to the brain is a very humane thing to do. When our feeling of well-being fluctuates during the day, when our capabilities fluctuate during the day, when people cannot be autonomous, then it's important that we offer them therapies that at least approach a better degree of autonomy.